what exciting news do you have this week about anything in medicine, pediatrics, medicine, other than vaccine? Anything you want to talk about?
I don't know if there's any groundbreaking stuff coming out, except for I think the vaccine is huge that they went down to age 11 and 12. Excuse me. And I know that Moderna right now, the Pfizer vaccine, COVID-19 vaccine is approved down to age 12 and under the EUA, emergency authorization. And Moderna is looking at that as well. I actually have 2 patients in my office, 1 7, 1 2, who are enrolled in the Pfizer study right now.
Oh my God. Is there any way for my twin boys to enroll? How do I do that?
I can send you some information once we're done.
Perfect.
Because I was thinking about having my 9-year-old do it.
Yeah.
And think about this is, so we're comfortable doing that.
Yeah.
And it really sounds like if your providers, like your pediatricians, your family practitioners, your internists, your OBGYNs are comfortable with this vaccine, it's a huge, powerful tool to encourage people to get it. And I tell people if that vaccine was available right now down to age 2, and I had a 2-year-old, I'd give it to him.
Yep.
And so I was thinking about having my daughter go into the trials,
Yeah.
but she's going to camp. It didn't happen last year, so she wouldn't be able to get her 2 shots apart.
Right.
So that's a downfall for that, but she'll have a good time at camp. No, but yeah, so I think that's big news on the horizon. And the other big news on the horizon is that this vaccine may be available soon down to age 2 by the end of the summer or fall, which I thought was going to be age 6 to 11, just usually how they break things up. But I think that's really, really big, really big.
Still the number one question, right?
What's
vaccine.
That? Yeah. And
with when someone delivers and they come to your office and say, "Hey, doc, I waited until I deliver. Here I am, my newborn. I have not been vaccinated. Should I?" I mean, they asked me the same question, but
that's a big question for me. I'll throw it right back at you first. I mean, so you predate me, right, with these infants that are coming to me. So you're seeing the moms, right? So that's the big question: is should you get it, during pregnancy?
And I tell them yes.
Do you have any reservations of when they get it?
No.
Great.
No, they should get it if they're, just had an ultrasound that confirms pregnancy at 7 weeks versus about to deliver next week.
Yeah.
Breastfeeding, I think you should get it.
Yeah. Yeah. I think, I the answer is yes, and I explain to people, why I feel that way and what information that we know and, the organizations that we belong to, like ACOG for you and the AAP for me, American Academy of Pediatrics, the recommendations, the CDC, and I'm very, very comfortable with this vaccine now. And I think I promote it. I promote getting it. I respect people don't want to get it. I totally respect that, but I really feel it's a safe vaccine. And I recommend it. So yeah, if they had it down to age whatever right now, I'd do it. But I think you're right. Like one of the big questions that we hear on both sides, right? If I'm, will it give my baby protection when they're born? And the answer is we're seeing yes. And parents, moms who are breastfeeding, we definitely know that some antibodies are excreted in the breast milk. So there's definitely some benefit there. I don't think that's a reason that you have to get it or that you have to breastfeed, but it's definitely a powerful reason, a byproduct of getting the vaccination. And we can talk about patient populations a lot, different high risk groups, and what we know in adults and kids and pregnant women, but for pregnancy, right? That's a high risk category. And I mean, we lived through H1N1, right?
Yeah,
and that was crazy.
Yeah,
that was crazy for pregnant moms.
Yeah.
And this is a similar thing in a way. Most are going to be fine, but if you can protect yourself, get the vaccine.
Yeah.